Good afternoon, everybody, and welcome to our introduction to healthcare science at the UK's specialist healthcare university. My name is Lanisha, and I'll be the host for the event today. And the format of the event will be a talk by Martin Bucknell, the admissions tutor for healthcare science. You will also have the opportunity to hear from a current student, and then we will also have a Q&A panel towards the end of this session. Just a little bit of housekeeping before we get going. So during this webinar, you'll be able to see and hear all the panelists, but we won't be able to see and hear you. If you need to communicate with us throughout this webinar, or you have any questions that you want us to answer during the Q&A session, you can type those questions in the chat box, and then we will answer those towards the end of this session. If for any reason there is technical issues and it disconnects from my side, if you guys just hold fire, I'll log back in as quickly as possible. That hasn't happened as yet, so hopefully today will be just as good. If there is something that happens your side and you cut out, just log straight back in. We will be here waiting. And if you do miss any of the webinar due to technical issues your end, the session is recorded, and so you will be able to see the video at the end of this session. It will be sent out to all of you in a follow-up email. Also, at the end of this session, I'd be very grateful if you guys would just take a few minutes to fill out our feedback survey. The survey will pop up as soon as the webinar has ended, and so we'd be very grateful if you could fill that out. And if you do, and you also include your email address at the end of that survey, then your name will be entered into a prize draw for a £30 Amazon voucher in January. Okay, so I'm now going to invite Martin Bucknell on screen, and he's going to talk to you about the healthcare science course. Thank you, Martin.
Hi, good afternoon, everybody, and thank you for joining us this afternoon. And a big thank you for your interest in healthcare science, and a big thank you for your interest in the course we run here at St George's. As Lanisha said, my name is Martin. I'm the admissions tutor for the healthcare science programme, and I'm also a senior lecturer on the programme. I'm going to talk today about the two strands of healthcare science we run here at St George's. That's the respiratory sleep physiology pathway and also the cardiac physiology pathway. And the areas I will cover over the next 15 to 20 minutes, I will talk about the role that healthcare scientists, or sometimes referred to as clinical physiologists, about their role, their clinical work. I will talk about the structure of the course, and hopefully I'll encourage you to choose to study healthcare science here with us at St George's. So, what is the role of a healthcare scientist? I think one of the fascinating and interesting parts is that you get direct contact with patients, and a wide range of patients from many different backgrounds, very young newborn babies through to elderly. And the role of healthcare scientists is to perform, analyse and interpret a wide range of routine and also very highly complex diagnostic tests. The diagrams at the bottom of this slide, and I'll talk about a few more a little bit later on, show an ECG or an electrocardiogram. This measures the electrical activity of the heart, and also one of our previous students, Charlie, is measuring somebody's lung function. So it's about performing, interpreting a wide range of routine complex tests. So again, working directly with patients. And the high quality test that you perform will have an impact on the patient's diagnosis and further management, whether that's atrial fibrillation, whether that's heart failure, cystic fibrosis, asthma, COPD, and millions more different diseases and disorders. As well as performing these ranges of different tests, you'll also be involved in actually treatment, so implementing treatment regimes for your patients. So that might be a patient with an abnormal heart rate who might require a pacemaker, or that might be a patient with respiratory failure who requires oxygen therapy. And as your career progresses, you may move on to senior leadership and management roles. So for example, healthcare scientists lead and manage very large physiology departments, often managing 30, 40, 50 staff, managing hospitals across different sites, and managing very large budgets as well. There's also opportunities to be involved in innovation and research, and that might be clinical research, clinical audit within the department to actually improve services. But healthcare scientists are also involved in research, but also publishing data in national and international peer-reviewed journals, and also showing their research at national, international conferences. And of course, involved in training, teaching, education. And as part of the course, we do have expert physiologists who also come along and do some great teaching sessions for us, as well as doing some teaching within the hospital placement sites as well. So what skills do you need? Lots of skills. So of course, working as part of a multidisciplinary team is important. And excellent interpersonal and communication skills. So communicating as part of the team, but communicating with your patients, their carers. And that may be a challenge. Some of our patients may have communication barriers. They may not speak English. They may have a disability. They may be deaf. They may be blind. They may have a learning disability. So excellent communication skills are required. Of course, you need to be caring and empathetic. Many patients who come are actually scared, anxious. You're going to perform some tests on them. Lots of patients don't like hospitals. Lots of patients might be scared about what the tests will show. That might include a diagnosis of lung cancer. The tests that you perform may impact on whether a patient goes for surgery. So certainly caring, empathy are key skills, together with professional behaviour and professional attitude. You will be using lots of routine and highly complex clinical equipment, consumables and technology. So again, it's important that you use that equipment properly. And if you don't, the equipment gives out the wrong answers, and that then impacts on the patient's diagnosis and treatment. And also high quality clinical skills and the underpinning scientific knowledge. And you will gain those from studying on this course. But again, as your career progresses, you will continue to update and gain new clinical skills and scientific knowledge. Working with accuracy and precision. As I said, if we get the wrong answers, we perform the test badly, we interpret the test badly, that can affect your patient's diagnosis and management. It can lead to misdiagnosis, the patient's on the wrong treatment, or the patient doesn't go for surgery, or the patient can't work. So never underestimate your role as a healthcare scientist and the impacts that has on your patients and their families and their quality of life. And also the ability to work in stressful and sometimes very busy clinical environments where you need to manage your time, manage your workload. Okay, the next few slides, I'm just going to show some pictures of some of the different tests that cardiac and respiratory sleep physiologists perform. And this is just a small number. There's lots and lots of different tests. Let me start on the top left-hand side. You can see a patient's chest with some stickers or electrodes on the chest. This is a 24-hour ECG monitor, so the equipment will monitor the patient's heart rate over a 24-hour or sometimes longer period. And it's healthcare scientists who are fitting these monitors, but also downloading the data, analysing the data, and writing complex reports on the outcome to inform diagnosis. Moving along, we can see echocardiography, and we've got some moving images there as well. So echocardiography is a highly skilled procedure. It's an ultrasound scan of the patient's heart, so looking at the size of the heart, the different chambers of the heart, the atria, the ventricles, the blood flow through the heart, and the way the different valves are function as well. So in your studies this year, when you're starting to look at cardiac function, just think in a couple of years' time, you could be making some of these really important and exciting measurements. Further along, we've got a picture of a pacemaker being implanted. And again, as part of the multidisciplinary team, healthcare scientists are involved in implanting pacemakers to correct a patient's pulse rate. And below, in a pacemaker follow-up clinic, where again, healthcare scientists are monitoring the pacemaker function, adjusting settings for the patient. And in the bottom left-hand side is just a picture of a cardiac angiogram. So again, working as part of a team with cardiologists, with cath lab nurses, with radiographers to look at the coronary arteries to see if there's any blockage. The next slide shows some respiratory physiology procedures. I'll start at the bottom this time, and you can see the chap in the yellow t-shirt. He's blowing into a piece of equipment called a spirometer, and we've got the physiologist there really communicating with the patient and teaching the patient how to perform this quite difficult test and measuring the volumes of air that the patient can blow out. And this really tells us how well the lungs are working, how clear the airways are. And if I just jump above this chap now, we can see a patient sitting in a box. That's called a body plethysmograph, great Scrabble word. Or lots of people just call it a body box, or patients just say, you're not going to put me in that box, are you? But again, we get patients to do complex measurements, lots of panting maneuvers against the shutter to measure the size of the patient's lungs. Does the patient have normal sized lungs? Are the lungs too small? Are the lungs too big and floppy? So really making quality measurements which inform diagnosis. In the middle, we've got a chap exercising on a bike. This is an example of a cardiopulmonary exercise test where we can monitor cardiac function and also respiratory responses to exercise. So this might be used if a patient is short of breath to see, is it a problem with the heart? Is it a problem with the lungs? Is the patient a little bit unfit? But used by respiratory and cardiac physiologists now to assess patients for suitability for major surgery, including lung cancer. And the top right, you can see somebody's left arm looks red, itchy, and we can see lots of raised lumps or wheals. This is an example of an allergy test where a physiologist might inject solutions just under the first layer of the skin, such as house dust mite, grass, dog, pollen, to see if the patients have any allergies. And in the bottom right-hand corner, we can just see someone taking a sample of blood from the radial artery. And again, we'll analyze this blood sample. We'll look at the oxygen levels, the carbon dioxide levels, the blood pH levels to see if the patient is in respiratory failure. And that will then inform their treatment, which they might require oxygen therapy, or they may require non-invasive ventilation. And this slide just shows the exciting area of sleep physiology. There's lots of different sleep disorders out there. This course focuses on obstructive sleep apnea, which you may have heard of. Obstructive sleep apnea is a condition where patients stop breathing, usually for 10 or more seconds, but they stop breathing many times per night. And in severe cases, they might stop breathing 30, 40, sometimes 100 times per hour of sleep. This disrupts their sleep quality. It makes them very tired and they fall asleep. They may fall asleep at work. They may fall asleep at school. They may fall asleep in the cinema. They may fall asleep driving their car. They may fall asleep driving their lorry on the motorway. So again, as healthcare scientists, and as part of this course, we will be assessing patients for obstructive sleep apnea by setting up lots of complex devices. We can see a very complex one here, and we can also see some very complex results, and your role is to analyze this data and to report the data, and also to tease out poor quality data to come to the correct diagnosis so we can get the patient on the right treatment as soon as possible. And we've got a patient there, you can see, fast asleep in bed with a little mask over his nose. This is called a CPAP machine. He wears this at night and it will blow air up his nose and keep his airways open to stop his airways closing at night and help to treat his sleep apnea so he's not sleepy, he can drive, he can concentrate, he's not snoring, his wife sleeping in the same bed, etc. And again, untreated sleep apnea can then lead on to consequences such as heart failure, stroke, diabetes. So again, never underestimate the role of healthcare scientists on the patient's quality of life. I just wanted to talk just very briefly about the course curriculum. It's broken down into 3 years. It's a 3-year full-time course, and it is a busy course. And we can see at the top in blue, we've got some of the different modules, and we can see professional practice modules which run across all years of the course. As I said, you are dealing with patients. You do need to work to eye professional standards. So this module includes areas such as communication skills, leadership, teamwork, gaining consent, etc. And you can also see in blue in years 1 and 2, scientific basis of healthcare science. And this runs across both years to give an underpinning knowledge of all of the different body systems. So again, cell biology, tissue biology, genetics, pharmacology, neurophysiology, genetics, etc., endocrinology. And in yellow, you'll see there's a specialist module on cardiovascular and respiratory physiology and sleep physiology, where we go into a lot more detail about the background of cardiac respiratory disease and lots of the different tests that you'll be performing on your clinical placements. And you'll see in year 1, in clinical training, you will have 10 weeks allocated to clinical placement, where you will go out in NHS healthcare science departments and start to practice what you've been learning in the classroom. And in year 1, you get to undertake placements in both cardiac physiology and respiratory sleep physiology. And you'll start to perform investigations such as ECG, spirometry, and a few other tests as well, and start to interact with patients and be a part of the team. At the end of year 1, you would then choose which area interests you, and then you would choose to specialize in cardiac physiology or respiratory sleep physiology. So in year 2, there's more professional practice. There's also a research methods module, and this starts to prepare you for a final year dissertation you will do in the final year. So this module includes experimental design, data collection, statistics, data analysis, ethical approval, and a lot more. There's a module on pathophysiology, and this starts to introduce lots of the disorders you will come across on placement, whether that's cardiomyopathy, whether that's heart failure, myocardial infarction, hypertension, sarcoidosis, pulmonary fibrosis, COPD, etc. And I can go on. There's a module also on instrumentation. As I said, you are using technical equipment, so you do need to have a clear understanding of how equipment works. And we discuss lots of the physics and the physical principles behind the technologies that you're using. And you will see in year 2, clinical training, you will have 15 weeks of clinical training in your chosen speciality, whether that's cardiac physiology or respiratory sleep physiology. And there's specialist teaching which goes with both of those. And in the final year, you will see you have a total of 25 weeks of clinical training. So the total clinical training over the 3-year program is a total of 50 weeks, where you will start to do more advanced procedures in cardiac or respiratory sleep physiology. There are teaching modules as well, so we can see applying cardiac physiology and applying respiratory and sleep physiology to practice. And there's also a large research project. It's an 8,000 word research project, and you will undertake that project in your clinical placement site, where you will have a clinical supervisor, but there'll also be an academic supervisor at St George's to support you. And on the clinical training in year 2 and year 3, we ideally like to send students to the same site across years 2 and 3, so they become part of the clinical team in their placement site. So why choose healthcare science? Hopefully I've convinced you. But certainly at St George's, in year one, you experience both specialities before specialising. Many universities offering this course in the UK only offer cardiac physiology. So we're one of only a few universities and the only university in London who offers both cardiac and respiratory training in year one and the choice to specialise. Lots of students come onto the course wanting to do cardiac physiology, but once they get to do some respiratory physiology, sometimes they change their mind. It's great to have a choice, isn't it? Um, High quality clinical placements. We've been running this program at St George's 8, 9, 10 years, and we've built up some great working relationships with our placement sites. So you get high quality clinical placements, not sitting in a corner, getting involved, working with patients, being part of the team. And we have great placement sites. Of course, St George's Hospital, King's College Hospital, Guy's and St Thomas's, the Royal Brompton, Great Ormond Street Hospital, and many, many more. As I said, you will have direct patient contact, working directly with patients and making an impact on their quality of life, and you will enjoy that patient contact. There are other courses where there's not as much patient contact, but it's a really key part of this course. We do offer some assistance with placement travel costs across all years of the programme, and we also do provide student uniform as well. We offer expert specialist teaching, and we have full-time healthcare scientist specialist tutors in both cardiac and respiratory sleep physiology. My background is as a respiratory sleep physiology, but I do have cardiac colleagues as well. And we're full-time based at the university, and we do still keep our clinical skills up to date. That's really important. Um, Excellent employment opportunities. I'll touch on that briefly on the next slide. Also, upon graduation, you're eligible for registration with either RCCP, that's the Registration Council for Clinical Physiologists, or AHCS, that's the Academy for Healthcare Science. So when you graduate, you are eligible for a professional register, which helps you to find your next job. As Lanisha said, we are a specialist healthcare medical university and also linked to the neighbouring St George's NHS Trust, so it's got a real strong medical clinical buzz to it. And on our NSS, that's the National Student Survey score. This is a survey, it's a national survey where final year students rate the course on different areas such as quality of teaching, feedback, course management, etc. And last year we scored, really pleased with 92.3%, but we keep working with students, listening to students, and hopefully we'll keep increasing that number. And just a brief note on employment. Our graduates get AFC or Agenda for Change Band 5 jobs very quickly and easily, and lots of students actually get jobs prior to graduation. So once they've graduated, they're ready to start working. Agenda for Change, for those who don't know, is just the NHS pay scales. And if you go onto the search engine such as Google, you can bring up Agenda for Change pay scales. But students gradually, very quickly, move on to Band 6, Band 7 jobs, and some onto Band 8 roles. Some students get placed on postgraduate courses. I know we've had some students in the past who've gone on to do medical ethics, global health, and students have gone on to also STP programs or scientist training programs, which you may have heard about or read about. These are NHS funded programs, and they are available in cardiac physiology and respiratory sleep physiology. And we have some students who've got onto these highly competitive courses. And also we've had several students who've gone on to graduate entry medicine as well, following their degree. Okay, well, thank you for listening. I hope you enjoyed that. I do look forward to hearing your questions. And I'd like to also just wish you well for your future studies this year, and also your choice of university. It'd be great to see many of you coming to study with us at St George's.
Thank you very much, Martin.
You're
I
welcome.
hope you all got a lot of the information that you wanted to hear about this course. I can see that some questions have been coming in, so please do continue to send your questions in, and we'll endeavour to answer those during the Q&A session. Okay, so now I'm going to invite on screen our current student who is who is in the second year of the course, Suvika. So Suvika, would you join us on the screen, please?
Hi everyone. So as Lanisha was saying, I'm Savika and I am a second year healthcare science student. So I'm just going to be talking to you about student life as a healthcare science student. Okay, so I think as a student, I spent most of my time in the Dragon Bar, also known as the SU Bar. It was like my chill spot while doing for example, during my lecture, well, between my lectures, and it has a very edgy, comfortable vibe to it. I spend most of my time with my friends there, grab a drink or grab a snack from Pret. We have two Prets at university, the cafe or the SU shop. And also, during my first year, I had Mondays off and Wednesdays were half day. So usually on those days, I would go down to the Robert Lowy Sports Centre, which is just around the university, and play badminton, just take the stress out after a long day of lectures. And I think when you think about university, you think about the academic side of it. You won't have much time to join events or join societies, but I got plenty of time to be part of societies. For example, I was part of Sri Lankan Society, Tamil Society, Dance Society, and they put out a lot of shows. We have a lot of shows throughout the year. So I put some examples on the screen. We have the Tooting show, the fashion show, there's the Diwali show. I think my favorite was the Tooting show. We had a lot of cultures, a lot of different dancers, and it was great to just go and watch them. And also Sri Lankan Society, they do this event called Take Me Out. I don't know if you guys watched the show, but it's kind of similar to that Take Me Out show, and it's really fun to just join in with your friends. And also, I think as a student, joining these different societies and making friends is a great way to get know each other. I was part of dance society, and I'm not very great at dance, but I joined the Bhangra team, and I just want to say, like, I had the best time, even though I'm not very good at dancing. I had so much fun just being there with my friends and getting to know new people. Also, I put a picture of library up there because towards exams, the library was my second home. I would spend hours in there just making my notes. Sometimes I would leave at around 9 or 10 p.m. Um, and also Tooting Broadway itself, I think it's a great environment because I leave library so late. You'd think that it might not be safe leaving the library, but Tooting Broadway is a very busy environment. There's always people going in and out, and I feel really safe going to uni and coming back home late. And I was a commuter first year as well, so that was great. And again, adding to the fact about Tooting Broadway, it's a great area. So during between lectures, sometimes if you have plenty of time, I would go out, grab a bite with my friends. You have restaurants of different cultures. So I'm Sri Lankan. I can find Sri Lankan restaurants and other Asian restaurants. And also if I want to do shopping, there's shops like Primark and TK Maxx out and about. So it's a great environment to be in. And yeah, that's it.
Thank you very much, Suvika. Okay, all right. So now we are going to go into the Q&A session. I can see more questions have been sent in, so thank you guys for sending those in. We will answer those now. Just before I respond to your questions, I would be very grateful if you guys can just take a minute out just to type in a question, well, not a question, an answer, just to let me know and let us know if the timing of this webinar was suitable for you, or what time of the day do you think would work better? So it's just for us to understand whether the time that we chose works well for the majority. Okay, so if I can invite Suvika and Martin back on the screen, and we will start answering some of these questions. Okay, so we've got one here specifically for you, Suvika. Somebody asked, what made you apply for the healthcare science course? How did you find out about it? And what other courses did you apply for?
Okay, so I originally applied for pharmacy on my UCAS application, but on results day I was like, no, I don't want to do pharmacy. I had a quick change of mind, so I quickly looked at all the options I had available, and I came across healthcare science. And I also remember one of my friends talking about doing this course. So on results day, it was a very last minute gut decision. I called up through adjustment and applied. I think what attracted me to this course was I was looking at the course page on the SGO website, and it was the placements. It's a very hands-on course. So from first year, you get to go on placements. I think it's 9 weeks of placement. So in cardiac and resp. So I was like, okay, this is a great opportunity, because most of the courses I know, you don't get to do placement until second or third year. So I really like the hands-on approach of this course. So I think that was one of the main reasons. The second reason is the option to specialize in cardiac or resp, because I'm that person who likes to learn what I like and not learn about everything. So that's the second reason. Yeah.
Okay, thank you. And a question for you, Martin, if you're able to answer at this time.
Have a go.
The question is, would you accept a student's application if it was a fifth choice for a student that was applying for medicine?
Yeah, if people apply and they meet the entry criteria, we would certainly, if they meet the criteria, we'd certainly invite them to interview. Absolutely. Yeah.
Perfect. Okay. And we have another question here. Sorry, just one moment.
And then, Alicia, just while you're looking at questions, just to add to
Yes.
that previous question, when we do interview, actually as a panel, we actually don't know if we're their first or second or third or fourth or fifth choice, so it doesn't matter, and we know that
Oh,
people
yeah.
change their minds as well.
Oh, yes.
Yeah.
Okay. Perfect. Okay. I had a few people ask, what's the difference between biomedical science and healthcare science? So what are the standout unique features of the course, would you say,
I
Martin?
think I think for me is the access to the clinical placements, where you get to go out on placement for 50 weeks. You get this direct patient contact, working with patients. I think for me, that's the big difference. Absolutely.
Okay, perfect. And there was a question about, so the question is, if this is one of only 2 healthcare science courses in London, how should the student position their personal statement? So maybe this is a good question for you, Suvika. How did you position your personal statement in terms of showing an interest in healthcare science?
I won't be the best to answer that question, because I did apply through adjustment. So when I was
Okay,
applying, my personal statement wasn't catered to this course.
okay, okay. Well, that's interesting to know, because obviously you're a second-year student that got onto the course with the personal statement that you had. So it does show obviously some flexibility around the statement, and
I mean, I
meeting the
can give,
requirements and things.
yeah, I think when you're writing the personal statement, you have to show about, because it's a patient-centered um, course, you have to show that you show those skills regarding being patient-centered, and you have to show good communication skills. So you just have to apply. So even if you don't have that much experience, it's what you learn from this experience. So even you have like 1 week of work experience somewhere in the healthcare setting or volunteering setting, you just have to apply what you learn from them. So it's not necessary how much experience you have. That's the main thing about personal statements, I think, in my opinion.
Okay.
And I would just add on to that. I totally agree, actually, on your personal statement. Just having an awareness of healthcare science, what healthcare scientists do. So go away and do a little bit of research. Just research a little about some of the tests. As Suvika said, that direct patient contact. So if you've got some work experience, doesn't need to be clinical or medical work experience. That's quite difficult to get in the COVID era as well. But if you've got some work experience just working with people, dealing with people, that's just as valuable. So, and show your enthusiasm to be a healthcare science and want to help patients.
Okay, great. Thank you. And another question, is neurophysiology included in the course? Maybe you could
Um,
answer that, Martin.
Sure. At St George's, we don't run the neurophysiology module. We just run the cardiac and the respiratory sleep modules. But the modules do include a lot of neurophysiology. Certainly, talking from a respiratory physiology background, we see lots of patients with diaphragm respiratory muscle weakness, for example, patients with motor neuron disease. So it builds in a lot of neurophysiology, and so does sleep disorders as well. So, but yeah, we don't have people who come on go train to become neurophysiologists.
Okay, great. Thank you. And another question, which I think both Martin and Suvika you could answer. Somebody asked about work experience, if you get paid while working on this course. So I guess from a placement side, are the placements paid, Martin?
The students will not get paid to go on placement. The placement sites do get some money from Health Education England to support training, so students won't get paid directly, certainly not by St George's, but we will help with placement travel costs and uniform. Students can go on to get part-time jobs outside of the course if they wanted to earn money.
Okay, thank you. Anything you want to add there, Suvika? Obviously, you are a current student. What else do you do to bring in extra finance for yourself while on the course?
Well, so as a student ambassador, you do you help out at events, and because of the current pandemic at this time, most of these are online. So like me helping out, just answering questions right here, I get paid. For example, being a student ambassador, you can also get part-time jobs around. So for example, if you are living out at uni, there's so many shops around Tooting Broadway, they can just apply for jobs around there, and there's always supermarkets or like fast food restaurants that's looking for students. So there's opportunities out there if you want to bring extra money.
Perfect. Okay, and then there's two questions here, which I'll answer those quickly. So somebody asked, can I change uni and start in year 2? And we wouldn't allow that. Everybody that comes onto any course at St George's has to meet the main entry criteria and will start from the first year of the course. And another question was, how beneficial will this course be towards a medicine degree? So if you're going to be applying to medicine at St George's and you would apply for the graduate entry medicine course, so we consider any degree for that course as long as you meet the grade requirement and you also sit the GAMSAT test. Different universities may have different requirements if you're joining them as a graduate. So just check the requirements for the universities that you're going to apply to study medicine to ensure you meet them with the degree and also any entrance tests that they require, like the GAMSAT or the UCAT. Yes. Well, you covered this a bit in your talk, explaining what exactly clinical physiologists do. But we did have a few questions about the career prospects once you finish the degree and what clinical physiologists actually do. Could you just clarify that a little bit more for us, Martin?
Yeah, I would say that 90% of our students graduate, get jobs as healthcare scientists very quickly. So working in NHS, cardiac or respiratory sleep physiology departments, and generally progress very quickly and move to more senior advanced roles. As I said, there are some students who go on to further study, whether that's scientist training program. I know from respiratory we've had 5 or 6 students who've gone on and got places on graduate entry medicine. And we've had one student in the past who's gone on to be a lawyer. So people
Wow.
use their degree in different ways. So yeah,
Okay.
so a good degree opens up lots of different pathways.
Perfect.
So
Thank you.
I don't know if that
I had
answered the question. Yeah.
I think it did. Someone also asked, how many weeks of the academic year does the course run, including placements?
Oh, that's a good question. I don't know off the top of my head, but it's a very, very busy academic year. So
Okay.
I'm happy to come back and answer that one in any email post
Okay.
webinar. It's a
Yeah.
good question. It's a busy year. There's a lot crammed into the, not trying to put people off, there's a lot crammed in to the 3 years, especially to
Okay.
get all of the placements in. But yeah, I'm happy to go back and give a proper answer to that rather than making up a number.
Thank you. Okay. So any questions that we are unable to answer, we will send a follow-up email with those answers out to you as soon as possible. But we are getting through most of them. Let's see what else we have here. We still have a few more coming in now. Am I able to transfer to healthcare science? I'm currently enrolled at a different university, or would I have to wait to the next academic year? So I think I kind of covered this before, regardless of if you're studying elsewhere or previous experiences. If you're going to come and study with us at St. George's, you need to meet our entry criteria is set, and you will start from year 1. So it wouldn't be a transfer in. Yes, and yes, that is the end of our questions. So any that were unanswered because they require a little bit of more work into getting an accurate answer, we will follow those up with an email. But we'd just like to thank you all for joining us today. We hope you got the information that you required about the course and about St. George's. If there are any follow-up questions that you have, please do send them in to us. You can send it to study@sgul.ac.uk. And if I could just remind you all, if you could just take a few minutes out once this webinar is finished to complete our survey, which will pop up as soon as this webinar has finished. And again, if you do fill out the survey and add your email address at the end, you will be entered into our prize draw to win a £30 Amazon voucher in January. So thank you, and we hopefully look forward to seeing you in the near future. Bye.
Bye-bye.